Good afternoon. Can you all hear me? Can you all see me, please?
Yeah, good afternoon. I can see you. I can see the rest participants. This is General Bala from Nigeria.
Thank you very much, General. Now, let me begin by wishing you all a very good afternoon from India. And I want to request all non-speakers at this stage to very kindly mute their mics so that we do not have an echo in the system. And when called upon to speak, please do unmute your mic before commencing your statement. At this stage, let me begin by firstly extending a very warm welcome to all of you who have joined us this afternoon, both from Nigeria and from India, for our very first seminar between India and Nigeria, especially at the level of our two institutes. And I wish to begin by acknowledging the presence of Lieutenant General Aliyu Gusau Mohammed, the founder of Gusau Institute. General Mohammed has a stellar background, having served as his country's national security advisor, as well as the Minister of Defense. I am Sujan Chinoy, the Director General of the Manohar Parrikar Institute for Defense Studies and Analyses. And I also wish to acknowledge the presence of Ambassador Abhay Thakur, the High Commissioner of India to Nigeria, Mr. Boss Mustapha, Secretary to the Government of the Federation and Chairman of the Presidential Task Force on COVID-19, as also the experts from Gusau Institute, distinguished participants. Thank you all for joining us this afternoon. Today, as you all know, we have gathered for the first bilateral event, albeit in virtual mode, between the Manohar Parrikar Institute for Defense Studies and Analyses and the Gusau Institute of Nigeria. We do hope that we can schedule regular meetings in the future to deepen our friendship and mutual understanding. My institute has a long history of contributing to India-Africa ties. For many years now, we have been hosting an annual Africa Day roundtable dialogue to commemorate Africa Day. While it is true that the focus of today's webinar is on India and Nigeria facing the COVID-19 pandemic together, it is vital that we seize this opportunity to broaden our discussions with the aim of deepening our bilateral ties in diverse sectors. Today, India-Africa relations as a whole stand completely transformed under the dynamic leadership of Prime Minister Narendra Modi. India has designated Africa as a top priority of its foreign and economic policy. Our developmental partnership remains anchored in the principles of equality, mutual respect, and mutual benefit, with demand being driven by African priorities. Friends, India and Nigeria share a unique bond. We are both large and populous countries. Our ties predate our political independence. We have in the past sympathized with and supported one another in the common endeavor to realize our true destinies as free nations. Nigeria indeed is one of India's key partners in Africa. Our partnership is multifaceted and multidimensional. We have deepened our cooperation in the energy sector and strengthened our people-to-people ties. Defense and strategic cooperation is also gathering momentum. The vast Indian diaspora in Nigeria acts as a bridge for robust bilateral engagement. Friends, the COVID-19 pandemic has taken a toll everywhere in terms of human lives and economic setbacks. It has sharpened geostrategic competition. At the same time, it has also invited the human race to look beyond immediate selfish gains, to work together to defeat what is arguably the most difficult challenge in a century. Economic recovery and the building of resilient supply chains to prevent future disruptions have emerged as important tasks. With the arrival of vaccines, the world is looking with hope beyond the pandemic. However, the globalization of the future should be redefined to ensure that there is inclusive growth. Vulnerable countries in Asia and Africa will have to guard against exploitation of their resources and markets through insidious debt traps. As the world's largest producer and exporter of vaccines, India's readiness to ship these to dozens of countries under its Vaccine Maitri, that is Vaccine Friendship Initiative, to fight COVID-19 is a good Samaritan act in consonance with the Indian ethos of Vasudhaiva Kutumbakam, which in Sanskrit means that the world is but one family. Healthcare provides us an opportunity to work together. India and Nigeria should also take the lead in working together in information technology. The has already extended the e-ITech course on COVID-19 pandemic for the prevention and management guidelines to be given to healthcare professionals. This has been extended to healthcare workers in Africa. We have the Arogya Setu app in India and also the e-Gram Swaraj app for rural areas for mapping COVID-19. Now, these are technological achievements that I believe might be useful to Nigeria as well. The COVID-19 pandemic has also brought to the fore the issue of mental health, an area that deserves closer attention. Since the movement of African students to India, including from Nigeria, for higher education has been disrupted, India could consider expanding the e-Vidya Bharati, that is tele-education project, to establish special virtual programs between Indian and Nigerian educational universities and institutions. The Indian Institute of Technology in Chennai, for example, has devised courses for coastal management for Mauritius and Seychelles. Something similar could be considered by Indian Institutes of Technology for Nigerian students. The fury of nature, you will all agree, often calls for a coordinated response, whether in Asia or in Africa. I believe there is scope for Nigeria to accede to the Coalition for Disaster Resilient Infrastructure, that is the CDRI initiative, which can lead to closer bilateral cooperation between us in this field. Collaboration in renewable energy holds great promise, with 33 countries from Africa, including Nigeria, having joined the International Solar Alliance. Nigeria's rare earth minerals are a reservoir for the high-tech manufacturing industry, including equipment required for harnessing renewable energy. Friends, the new US administration has recommitted itself to multilateralism. This augurs well for the UN and other agencies such as the WHO. It also helps the return to the fore of the Paris Climate Agreement. We believe that India's non-permanent membership of the UN Security Council in 2021-2022 will give it a fresh opportunity to engage others and help strengthen multilateralism. Today, the concept of the Indo-Pacific is gaining wider currency. It is a contemporary and representative term that recognizes that economic growth and prosperity is not the sole purview of a few. Asia and Africa as a whole are showing the same promise that East Asia showed a few decades ago when the world spoke of the Asia Pacific. Friends, our shared maritime interests remain anchored in developing a blue economy, particularly in the context of what Prime Minister Narendra Modi has described as Sagar, that is security and growth for all in the region. We, that is India and Nigeria, have shared stakes in ensuring unimpeded commerce and freedom of navigation and overflight along key sea lanes of communication. As piracy rears its ugly head in the Gulf of Guinea, India could share with Nigeria its vast experience in fighting this menace in the Indian Ocean. Maritime domain awareness, that is MDA, has assumed great importance. In addition to its hosting the International Fusion Center for the Indian Ocean region, India has recently become an observer to the Indian Ocean Commission and the Djibouti Code of Conduct and its 2017 Jeddah Amendment. India is also posting naval liaison officers to the Regional Maritime International Fusion Center in Madagascar, among other places. In all, India has concluded wide shipping agreements with 21 countries to facilitate the task of cooperating to keep the seas free, open, and safe. Perhaps the two governments of India and Nigeria might like to examine the scope for conducting a wide shipping agreement between us. That we, of course, will leave to the experts to look into. There is also great potential, I believe, to engage in fruitful cooperation in cybersecurity, counterterrorism, and military training. It is a matter of privilege for India that the Nigerian president, His Excellency Muhammadu Buhari, is an alumnus of the Defense Services Staff College in Wellington, in Tamil Nadu, in India. Given India's rich record of participation in peacekeeping operations in Africa and Nigeria's own considerable profile in this regard, it would naturally be of mutual advantage to the both of us to strengthen cooperation in peacekeeping. Overall, I'm very glad to inform you all that India's defense cooperation with Africa is growing, as evident in the AFINDEX 2019 field exercise and the Milan naval exercise. The first ever India-Africa Defense Ministers Conclave held in Lucknow during Defense Expo on 6 February 2020, and the recent participation of African dignitaries at the Aero India exhibition 2021 held in Bangalore have consolidated these links. Stronger India-Nigeria ties will definitely promote multipolarity, as also give impetus to developmental partnerships at the regional and global levels. I'm confident that today's discussions will throw new light on many issues and also outline a blueprint for a more robust India-Nigeria partnership in these difficult times. I would now request Lieutenant General Aliyu Gusau Mohammed, the founder of the Gusau Institute, to kindly grace this occasion and to deliver his opening remarks. I give the floor to General Aliyu Gusau Mohammed. The floor is yours. May I request the General to kindly unmute his mic and to kindly take the floor.
Let me begin by welcoming all speakers and the participants to this webinar. Your participation is a clear statement that you are committed to providing solutions to the COVID-19 pandemic, particularly the challenge of vaccinating our population. On behalf of the Gusau Institute, I want to state it is our pleasure to co-host this event, focusing attention on the best strategies to collectively combat the COVID-19 pandemic. It is the first event which the Gusau Institute is co-hosting with the Manohar Parrikar Institute for Defense Studies and Analysis in India, and we look forward to expanding this new partnership. By participating in the webinar, the Gusau Institute aspires to lend its voice to the articulation of Africa's peculiar requirements in the fight against the pandemic. Since the outbreak of the pandemic, the coronavirus has officially infected more than 122 million people, killing at least 2.69 million. Though Africa, with its 1.3 billion people, has seen fewer deaths from COVID-19 to date. The exact reason for this is still unknown. However, early and decisive action in many African countries that impose lockdowns of varying degrees with restrictions such as curfews, bans on gatherings and international flights, border closures, and other tough measures significantly contributed to the containing the spread of the virus on the continent. Decisive action should again play an important part in the quick rollout of vaccination programs in African countries. While 2020 will be known as the year that the global community had to focus all its resources on deciphering and managing a pandemic that irreversibly changed our way of life, we believe 2021 will be more about the vaccines deployed against the disease than the disease itself. Inequities in COVID-19 vaccine distributions are, however, already the order of the day as vaccine demand outstrips supply. Currently, just a handful of COVID-19 vaccines have been deployed, mostly by a few medically advanced countries, and the production, distribution, and delivery are still falling well behind demand. This has led to a rise in vaccine nationalism, where countries are reluctant to share their stock with others until their populations have been inoculated against the virus. Although governments are understandably under enormous pressure to take care of their citizens first, it is clear multilateral cooperation for equitable distribution of vaccine is the only way to successfully counter the disease. We should keep an eye on the long-term global picture and the health requirements of the continent. Should the coronavirus be allowed to exist uncontrolled in Africa, it will hold serious health risks for the rest of the world. Our collective health security cannot be considered in isolation, but with the cooperation of vaccine manufacturing partners. I would therefore like to use this opportunity to urge all participants to propose innovative ways in which we can collaborate to eliminate this terrible scourge for the mutual benefit of all. I strongly believe we need a more equal partnership for health for all, as it will determine not only the cause of COVID-19, but the impact of the next epidemic that will threaten global health and the others that will follow. I want to use this opportunity to recognize and welcome and express our appreciation to Mr. Boss Mustapha, the Secretary to the Government of the Federation, as well as the Chairman of the Presidential Task Force on COVID-19 Nigeria, for finding time to deliver special remarks. Thank you for your attention. I wish you fruitful deliberation.
Thank you very much, General Aliyu Gusau Mohammed, founder of the Gusau Institute and today's co-chair. Thank you very much for your very, very thoughtful remarks. I now turn to Ambassador Abhay Thakur, the High Commissioner of India to Nigeria, to kindly deliver his special remarks. Thank you, High Commissioner Abhay Thakur, for also joining us today. It is indeed a very, very good sign that you have spared your valuable time to be with us today. The floor is yours.
Thank you, sir. His Excellency Ambassador Sujan Chinoy, Director General of IDSA, His Excellency General Gusau, Aliyu Mohammed Gusau, founder of the Gusau Institute, His Excellency the Secretary to the Government of the Federation, Mr. Mustapha, ably represented by his office, and all the senior colleagues, Ambassador Manjeev Puri, representative of the governments of both sides. It's a great pleasure and honor to be able to be a facilitator in putting this very important interaction together today morning. I really want to, at the outset, thank IDSA. I know they are a very, very busy institute with a very, very heavy calendar. operating in busy times out of New Delhi. And it's a great pleasure that such a leading think tank of India has taken the leadership in engaging with Nigeria. I also want to especially recognize the Office of the Secretary to the Government of the Federation, which is equivalent to the Cabinet Secretary's office in India, who is piloting the entire efforts of COVID-19 management officially in Nigeria and during these very tough times to be able to join us. I think this seminar holds a lot of promise. There are a number of things that were mentioned by Ambassador Chinoy and General Gusau about what we are doing. Let me put a few additional points, some of it without repeating what has already been said. We have a very, very long-standing relationship with Nigeria. We are both, India is the largest democracy in the world. Nigeria is the largest democracy in Africa. And there are a number of similarities in our systems and our ways of conducting, national affairs, from which there is much learning that has gone into both ways. In fact, I would like to recall here what President Muhammad Buhari said on Democracy Day when he was inaugurating his second term, that there are countries in the world, large countries in the world, developing countries which have succeeded. China, India, and Indonesia are among them. China and Indonesia did so in an authoritarian framework, and India achieved its development in a democratic framework. If India can do so, so can Nigeria. So this was, in a way, summing up the extent of collaboration that is possible between both countries when it comes to any matter of national importance, whether it is security, whether it is economic development, IT. In the field of IT, we have been talking about Nigeria learning from the Indian model, for example, the low data cost, the Aadhaar, which is the unique ID payment, unique ID, and the digital platform for settling payments. And these are the things which are, very, very attractive to Nigeria. Nigeria is the, if I may, the world's most mobilized nation. 85% of the country accesses internet over mobile because of want of, other infrastructure. But having said that, it's a very, very mobile country, which is one of the world's leading mobilized nations and wants to learn and do a lot with India. In terms of the cooperation during the COVID-19 pandemic, yes, we were both in a difficult phase trying to work out, understand how better we can do business in this very difficult time. But I'm happy to report that with goodwill on both sides, in fact, our cooperation and interactions have actually strengthened during this COVID pandemic period, rather than being diluted in any manner, because we've had we've actually got rid of the need to travel, visas, hotel accommodation, and so on, which were in some ways a real constraint because of lack of direct flights or visa related issues in terms of interaction. So I would say we had 30 business and economic chambers talking to each other over the last 1 year period. We've had at least half a dozen think tank discussions, and today is really one of the peaks of such an interaction. We've had a virtual interaction between the two foreign ministers, which lasted 1.5 hours. We've had a signing of an MOU on outer space cooperation, again done virtually. And we are looking forward to, much more interaction. And I think Indians and Nigerians are feeling much closer to each other than they were before the pandemic. Of course, we have a very old, long-standing relationship based on deep mutual trust. Some of the, His Excellency Ambassador Chinoy mentioned about President Buhari. I also would like to add that 2 other former presidents of Nigeria have been alumni of Indian defense establishments, including President Obasanjo and before him, President Babangida. We recently had the visit of the Nigerian National Security Advisor to India earlier this month for the first ever strategic and counterterrorism dialogue co-chaired by the two NSAs, which was extremely important. This was an in-person interaction and brought out a number of areas of cooperation, including counterterrorism as well as policing, riot control, how to identify threats in advance, security threats. And one of the examples that the Nigerian NSA mentioned was, we could gauge and counter the Punjab militancy very well. And this is something that Nigeria wants to learn from, given the host of issues that it faces. All in all, the cooperation during this period has actually strengthened, including in the think tank, on that score. We will be having a visit by the Nigerian Foreign Minister. I had the honor to call him yesterday for the Raisina dialogue. And this will be the first ever Nigerian involvement at this level in the Raisina dialogue as the largest and leading country of Africa, which prides itself as the largest black nation on earth, and carries the flag for and the torchbearer for Africa. We are joined by a number of commonalities. Democracy was one. English language is very important. We can talk very freely to each other. We do not have issues that come, that are clouding the relationship in any manner. Nigeria is our largest trading partner, and India is Nigeria's largest trading partner globally. So there is a lot going. Among the areas of cooperation which can, I would like to touch upon some of them, can hold a greater promise for cooperation during the COVID ongoing period. One, of course, we were happy and particularly delighted that the Serum Institute of India's Covishield vaccine has been the first and only one approved so far by the Nigerian health authorities. And it was the particular variant of AstraZeneca, which is produced by the Serum Institute, which is the one which is approved. And we could send one of our largest consignments of 3.92 million doses earlier this month. I'm happy to inform that today afternoon at 4 p.m. I will be handing over India's grant, a gift of 100,000 doses of vaccines to the Secretary, to the Government of the Federation. And we have also donated 200,000 doses for UN peacekeepers, of which Africa, contributing nearly 50% of the peacekeepers globally, would be a big beneficiary. We've had similar approaches to vaccine internationalism. I had the pleasure and the privilege to call on the newly elected Director General of the WTO, Madam Iriala. She was in Abuja 2 weeks ago. And in fact, the entire conversation centered around how to deal with public health crisis of this nature. And even if today we are not able to get the requisite waiver for the India-South Africa proposal for easier IPR norms for vaccines, at least the grounds have been prepared. Both countries can put their greater weight in the multilateral trading platform to ensure that at least in future, such public health crises, wherever they arise, we are well prepared to ensure that the requisite waiver is available in time, in fact, automatically, without having to go to the formal WTO mechanisms. And this is one area where, of course, greater discussion is possible and both countries can pull their weight together, particularly with Africa. The other important area I felt was Nigeria has recently launched a major initiative on traditional and complementary medicine. And in fact, they have launched an institute in which the Indian ambassador, that is myself, was the only foreign head of mission invited. And we are talking about traditional African medicine. They want to learn very much from India's Ayush expertise and how in the field of Ayurveda we have developed so much expertise which we can share in terms of management. One of the key things is how have we really recognized Ayurveda as a regular degree, a medical degree, and going to the extent of surgery in India. And how has it gained recognition in terms of the medically? And this is what Nigeria has great interest in, and has formed a TCAM committee, of which I'm sure we will be able to which we will be able to contribute to. Again, the area of logistics disruption came, was a principal concern during the COVID pandemic. Nigeria has approved its a model of e-customs, under which the entire customs procedure for movement of goods and port handling has been approved by the Nigerian cabinet. It's a major project of over $3 billion, in which India's Larsen & Toubro and Bharat Electronics Limited are providing important solutions, for example, either through surveillance boats or radars and so on, for the use of customs, as well as we can cooperate further to ensure that at least in the area of port handling and customs, there are no bottlenecks. So ever important when we think about an average container from Asia or any other part of the world coming to Nigeria, taking not less than 3 months. So again, this is a very important if we have to support each other. Ambassador Chinoy mentioned about CDRI. I would like to add that Nigeria, sir, has already acceded practically to the CDRI. They are participating in the CDRI. The procedure in the internal system here is it requires formal ratification, which will take time. But having said that, Nigeria has joined the CDRI and is already participating in its activities. India has also joined the FOGG plus, the Friends of Gulf of Guinea plus under the it's a multilateral framework for handling piracy-related issues in the Gulf of Guinea. We have offered a special high-tech course for maritime security for Nigerian Navy, NIMASA, and some other institutions. We'll be happy to take this forward. Let me add, just as an aside, as an interesting observation, we had about 8 incidents in which Indian sailors were themselves involved in the last 2 years, with about 72 Indian sailors were involved. But I am happy to report that all 72, virtually, one of them died owing to not unrelated due to an illness, but all 71 were eventually released. So this is an issue that we are handling by taking it's more an industry, a ransom industry that is being talked about rather than classical piracy, if I may. And so in all these, we did have several incidents, but in all of them, eventually after a period of 2-3 months, we had the satisfaction as well that all sailors were released and safely repatriated back to India. No major logistical disruption, whether in terms of trade, has come to light, but of course, greater security measures need to be taken. So with these words, I could go on and contribute during the webinar, but I think there is a lot that both countries are doing together and can do more. I thank Gusau Institute for taking the lead from Nigeria, and look forward to very fruitful deliberations and more ideas coming up, which both governments can sit together and implement. Thank you for your attention.
Thank you very much, Ambassador Abhay Thakur, for your very detailed, very, very helpful and perceptive remarks, which in fact are a source of great optimism for us, as you've elaborated how close we have come to one another, especially during the pandemic. So more power to your elbow and to your team there that supports you in the execution of all these very important tasks of bringing us even closer together. I now turn to Mr. Boss Mustapha, Secretary to the Government of the Federation and Chairman, Presidential Task Force on COVID-19, to deliver his special remarks. And it's really very important that you've joined us today, considering the very important and onerous responsibilities that you have in tackling this pandemic. Thank you, Mr. Mustapha. The floor is yours.
Thank you, Mr. Sujan Chinoy. Okay, so the coordinator or the program director, I want to recognize the Ambassador Sujan Chinoy, the DG Manohar Parrikar Institute, our own Lieutenant General Aliyu Gusau Mohammed, the founder of Gusau Institute. I also want to appreciate His Excellency, the Indian High Commissioner to Nigeria, Ambassador Abhay, Thakur. Distinguished participants, ladies and gentlemen, good day. My name is Dr. Mberi Morris. I'm the Permanent Secretary, General Services Office, in the Office of the Secretary to the Government of the Federation. I am here to represent my boss, the Secretary to the Government of the Federation, and the Chairman, Presidential Task Force on COVID-19, Mr. Boss Mustapha, who is regrettably absent from this program. He has a very pressing national engagement at the villa. I will read the message of the Secretary to the Government of the Federation and the Chairman, Presidential Task Force, Mr. Boss Mustapha. I am delighted to be part of this webinar to discuss how India and Nigeria can face the COVID-19 pandemic together. Let me thank the Gusau Institute, founded by our own Lieutenant General Aliyu Gusau Mohammed, retired, and the Manohar Parrikar Institute for Defense Studies and Analysis of India, who have joined forces in the fight against this COVID-19 pandemic. There can be no better time to bring more stakeholders together to fight this dreaded coronavirus that is ravaging the world than now. The response in Nigeria and indeed around the world has been robust, collaborative, and united. That is why the collaboration between the Gusau Institute, Nigeria, and the Manohar Parrikar Institute of India is a welcome development, because, as the saying goes, no country is safe until every country is safe. I also wish to appreciate and commend the efforts of the Indian government, Nigeria, in the fight against this pandemic. I want to thank all the efforts of the government of India, and of course, I appreciate the organizers of this webinar at this point. On the 11th of March 2021, I added my voice to the United Nations campaign for fair and equitable distribution and administration of COVID-19 vaccines globally, because the hashtag "Only Together we can overcome the pandemic and be safe." Today, I also add my voice to affirm that global problems require global solutions. Hence, I support and commend the partnership between these two institutes to fight the COVID-19. Your Excellencies, distinguished ladies and gentlemen, this virus is still very potent, and people are still being infected in their thousands on a daily basis. As you are all aware, some countries are recording a third wave of cases, and therefore, there is need to emphasize and promote the strict adherence to the known non-pharmaceutical interventions, such as regular hand wash, monitoring social distancing, regular testing, avoiding large congregations, and then, of course, wearing the face mask, especially in public places. The non-compliance with COVID-19 regulations and growing evidence of vaccine hesitancy will continue to endanger millions of lives globally. I therefore urge all world leaders to mobilize and instill the sense of responsibility for themselves and their loved ones in the fight against COVID-19 and be vaccinated. I also call for the scaling up of affordable vaccine and distribution around the world. The more the availability of vaccines and wide administration, the earlier we can achieve herd immunity so that we can have our lives back to normal. These vaccines, I must tell you, are safe and efficacious. The Presidential Task Force on COVID-19 consists of a highly professional and dedicated multi-sectoral team to drive the process of safe and efficacious vaccinations across Nigeria. To this end, I am confident that with the support and that of other well-meaning world leaders, we will overcome this pandemic and restore our socio-economic lives once again. I thank you for listening and wish you a happy deliberation. Thank you so much.
Thank you very much, Dr. Maurice Mabaria, for delivering the special remarks on behalf of Mr. Boss Mustapha and for giving us your insights into the handling of the COVID-19 pandemic at your end. We wish you all the very best and stand ready to cooperate with you as well.
Thank you very much.
Friends, this brings us to the end of the inaugural session. And what lies ahead is session 1, which will be chaired by Brigadier General Saleh Bala of the Gusau Institute Steering Committee. He's a member of the steering committee. He will chair the first session on identifying areas of cooperation between Nigeria and India in controlling the COVID-19 pandemic. So we are getting down to the specifics now of cooperation on this particular issue. So may I now request the chair, Brigadier General Saleh Bala, to kindly take the floor and to take us through the next session. You, of course, are aware of all the speakers that you have on both sides. We have 2 speakers from our side who will be introduced to you by the chair. Over to you, Chair.
Oh, thank you very much, Ambassador, Your Excellencies, our own very distinguished participants. As I was introduced, I am Brigadier General Saleh Bala, a member of the steering committee of the Gusau Institute. Time is well spent, so I won't take your time in further speeches. To our Indian colleagues, I say namaste. I am to chair, I have the privilege to chair the session on identifying areas of cooperation between Nigeria and India in controlling the COVID-19 pandemic. And there are 2 thematics. The first is response to the COVID-19 pandemic that will be handled by Dr. Nasiru Sani Gwarzo, the Permanent Secretary, Federal Minister of Industry, Trade and Investment, and head of the Presidential Technical Committee on COVID-19, and Mr. A. Vinod Kumar, Associate Fellow of MP-IDSA. Then the second thematic will be strengthening the role of multilateral health institutions, which will be dealt with by Ambassador Manjeeb Puri, the former ambassador of India to the EU, Nepal, and ambassador of DPR of India to the UN at the New York, and Professor Nasid Abdulsalami, former CEO, Nigeria Center for Disease Control and Executive Director, ECOWAS Regional Center for Disease Control, who actually has a challenge joining us, but I believe by the end of the 35 minutes that his predecessors would have spoken, we will be able to clarify that that technical problem, so they join. The rule is very, very simple, that each speaker will speak for 10 minutes, and I will learn to be the typical regimented brigadier general by being very, very strict on time. And because it's my own little privilege of exercising command after leaving the army for 6 years now. I will quickly do this. The speakers are really very, very distinguished with very huge CVs, but they will do me the benefit of forgiving me that I am only going to do a summary of their achievements. The first I go straight is Dr. Nasser Sani Gwarzo, a public health physician who is currently the permanent secretary of the Federal Ministry of Industry, Trade and Investment. And before then, he had gathered over 30 years of significant experience in various areas of health in Nigeria and abroad. He led the team that characterized the lead poisoning epidemics associated with artisanal gold mining in Zamfara and Niger State, as well as institutionalized the strategic response and control interventions. In 2014, he led the team that screened and mounted surveillance on all the airports related Ebola risk and cases as a result of direct contact with the index Ebola case, thus helping in preventing the further spread of the epidemic in Nigeria. Recently, upon the recommendation of the Honorable Minister of Health and approval of Mr. President, Dr. Gwarzo was seconded back to the health sector to lead a team of experts, which is the Ministerial Task Force on COVID-19 response in Kano State. Dr. Gwarzo has served Nigeria in various capacities and is indeed a distinguished honors personality, both in Nigeria, the UN, and the United States. His merit awards of excellence for professionalism and leadership include 2-time awards of the United States of America Superior Honor Award, and a lot more. The next speaker will be Mr. Vinod Kumar. I will appreciate it if the web controller will be spotlighting these gentlemen as I introduce them. Vinod Kumar is Associate Fellow at the Manohar Parrikar Institute for Defense Studies and Analysis and a visiting faculty on the Institute of Foreign Policy Studies, University of Calcutta. His research interests include nuclear policy issues, energy and deterrence, missile defense, and India's relation with the great powers. Kumar's first book, entitled India and the Nuclear Proliferation Regime, The Perennial Outline, has been published by Cambridge University. His ongoing research is on implications of missile defense for nuclear deterrence. Concurrently, he is also spearheading an archival mining effort to trace India's nuclear and foreign policy history. Kumar is the recipient of the Ministry of Defense Madras Medal. Can we kickstart with the Honorable Permanent Secretary, Dr. Nasser Gwarzo Sani, please. You have the floor for 10 minutes, sir. Thank you.
Thank you very much, Mr. Chairman. And I'm starting my stopwatch here to also monitor myself. Distinguished participants, our very big guests on the two sides, India and Nigeria. Today is a very happy moment for me to join this important meeting. And I wish to start with some very good historical perspectives. Everybody that has grown in the educational system in Nigeria has encountered some very good Indian support, either at school. I still remember the names of my teachers in secondary and university, and up till the work in the health sector. So India is a household name in Nigeria. I believe this is a good continuation of those good old efforts. We've had very good collaboration historically in education, health, and I also want to draw the attention of the participants of the huge support India has provided Africa in tackling meningitis in the entire Lapisoni belt, which is the meningitis belt in Africa, through production of generic Menohar vaccine, which has totally reduced the incidence of meningitis in the continent. Recently, we also know the history of antiretroviral drugs that Nigeria has been benefiting, buying from India. The same thing with the vaccines now. and of course, pharmaceutical manufacturing in Nigeria and the importations. One very important issue which I will also want to raise is the issue of active pharmaceutical ingredients that we call APIs. I will come back to this. It will have historical relationship in this area. We also had a very good relationship with India on battery reclamation and recycling of iron. Now coming to the epidemic and the response where India has played role. India is one of the first countries that has donated medications, even during the period of uncertainty, to the efficacy of hydroxychloroquine and other drugs. India has come to the rescue of Nigeria, and also on the ongoing vaccine program, which is through a multilateral arrangement. But I'm happy to hear the ambassador mention the direct bilateral support to Nigeria. Now I move on to the response. Like it's written in the agenda, I am the head. I led the team that went to Kano, the ministerial task team. It's not called the presidential task team, it's a ministerial task team, but approved by Mr. President. And I'm happy to say at the time we went, the situation was very, very dire. There was both an epidemic of mysterious deaths. There was also an epidemic of sickness, which is morbidity, and also an epidemic of fear, panic. Those three situations characterize the response time that we went to Kano. And after 6 weeks of response, we were able to provide all the necessary support in terms of mobilization and supporting the state instruments, the state strategy team, to put in place a befitting response which helped in reducing mortality and also at the same time reducing the morbidity and to a significant extent allayed anxieties, which was very, very typical of that period of time. From one testing center at the time we arrived in Kano, we were able to increase the number of testing centers to 3. From a capacity of about 24 tests per day in Kano, we increased it to about 600 per day in Kano. And samples were no longer had to go from Kano to Abuja. That was the situation then. And also the response teams were about 21 at the time we arrived, but by the time we left, it rose to about 76 response teams. So in essence, people were better satisfied. People's response, when they called the emergency number, they had very good response in shorter times and very good adequate care. Isolation centers were increased, and also sample collection centers were also increased. Now, based on evidence, we established a program which was a research arm of our work that studied all the deaths through post-mortem analysis of deaths that have occurred. Both we went to the community, we also went to the graveyards, we went back to hospitals, and we began testing samples in post-mortem samples. And we were able to pinpoint the cause of death, and we traced it to 2 causes. Mostly it was it was corona, but also we also found deaths that were related to the epidemic situation because of the panic, because of the difficulty health institutions were facing. The number of people that were receiving good quality care in hospital had reduced. Number of people even wanting to go to hospitals has reduced. So many people died at home, many people died in transit, and many people also could not even access care at all. So we couldn't even know more, even if more people had died. That was the situation of the response at the time we arrived. But I'm happy to say by the time we left, 6 weeks after, there was so much improvement. And of course, it was not only to our credit, but it was to the credit of the Kano state government. All we did was to help them fine-tune the response, provide guidance on how to establish the response structure, and also coordinated the routine media, information that goes out both to government at Kano state level, to the federal government, as well as to the public, That significantly reduced the panic and the anxiety because people were getting real-time information, which helped them to understand the pandemic as it was evolving. At that time, there was no vaccine. So all the remedies that were being used were those that were had minimal evidence, but it worked. Now, moving on to the lessons learned from this. At the same period in my ministry, the Ministry of Industry, Trade and Investment, we established an emergency response program where the industries were kept open in spite of the lockdown, and inputs going into the industries were kept flowing, likewise outputs as well as logistics to the end beneficiaries in numerous parts of the country. One significant challenge that we faced was imminent loss of input because importation was out. And one issue that is very much related to India, which I will voice out here, was the ban then by both India and China on the exportation of APIs, active pharmaceutical ingredients. That almost grounded our factories in Nigeria because we needed to import them from India, and India had a ban, and also logistics across the world was difficult. And for the benefit of those of us who want to, on vaccination, to produce a vaccine, many components are required, sometimes as high as over 100 inputs from different countries, up to 18 different countries. So banning of one aspect from one country can affect the entire production line of a vaccine anywhere in the world. Therefore, that ban by both India and China posed a great threat for us, not only because, despite the fact that we're not producing vaccines, but it was affecting our local industries. On the lessons learned, I believe that one of the greatest lessons learned is being frank and factual when there is an epidemic. There was a lot of denial across the world, but everybody that saw what Nigeria did, particularly the presidential team, accepted that there was an epidemic, led the public in the information program, which kept Nigerians transparently involved, and that has been very helpful. Second is that preparedness is so important ahead of any epidemic. And of course, the world will continue to witness epidemics, so we need to continue to prepare. Then also the investment in diagnostics and medicines. This is a place where Nigeria has learned a difficult lesson, and if there's an area of collaboration that Nigeria will benefit from India, this is one of it. For API production, for establishment of local manufacture, because even if you rely on importation and donations, it is difficult during a time when the whole world was closed down. The fourth and most important is political will. Of course, Mr. President showed a lot of political will, which to me has kept the response alive. If he had denied it or had gone into denial, we would all have been in the same problem where we started at the beginning. Fifth, and also is the issue of international trade. International trade barriers, especially the exportation of APIs and other materials, are so important. I can see my 10 minutes is over.
One more minute, sir.
Use this opportunity. One more minute, thank you very much. I also want to use this opportunity to once again thank India for being forthcoming, even without prompting, to support Africa and Nigeria, and also, like Oliver Twist, ask for more areas of collaboration. Our door is open in the Ministry of Industry to open up opportunities for industrialization and also sustainable growth of our systems, and a healthy partnership between the two countries. Thank you very much.
Thank you very much, sir. If I will do a quick capstone, it is to say to appreciate India for being the first country to donate drugs and the initiative of donating vaccines to Nigeria. That federal and state coordination and support was very, very germane to the effort in Kano, which also the effort at public communication and mobilization helped to ward off fear and the conspiracy theories. This is a big lesson all of us should learn. And even as the vaccine administration is going on now, we know the issues of fear and conspiracy theories that are impinging on it. Next is the lack of local input and the loss of local input by material nationalism and import restrictions and outright bans. This mitigated effort across the world. And that local sourcing and manufacturing is very, very important. But overall, because we are running democracies, all our systems are governance-led, and political will is a very, very important substance to driving our nation's effort at keeping safe and secure. Thank you very, very much, sir. Next, I will have the privilege to invite our next speaker, Mr. Vinod Kumar, to the floor, please. Sir, you have 10 minutes.
Sir, thank you so much. Am I audible?
Yes, you are, perfectly.
Okay, before my time starts, I would request the webmaster to kindly allow the PowerPoint share facility, please.
Okay, in that case, you have 1 minute to accomplish that.
Of course. Thank you.
So now your 1 minute starts.
Thank you, sir. As you all know, protecting the second largest population in the world from a pandemic of this nature is a mission of colossal proportions. And that's what India quite successfully and effectively achieved, irrespective of the kind of effects we had in our society and the economy. So when the pathogen hit, the first case hit our shores in the last week of January, the only thing we had from then to around March, end of March, when we decided to initiate what was the world's largest, probably in proportion and size, the world's largest contagion mitigation exercise by locking down 1.37 billion people to protect against this pandemic. Between this period from January end to the March end, the only defense we had against this pathogen were the thermal scanners at the airports to single out people with incoming passengers with any kind of symptoms of the infection, and whatever was the symptoms which were known at that point of time. So from then, why we moved to this particular exercise was, of course, during this period, a lot of existing air corridors, active air corridors, brought in the virus into the country. And it seemed at that point of time, we were not really geared to deal with this kind of situation, and how the challenge of protecting the world's second largest population, we didn't have the kind of wherewithal at that point of time, because RT-PCR was not a kind of mechanism which was prevalent that time. Producing masks and sanitizers on a national scale of this proportion. So considering all these factors, the government decided to impose what was national lockdown for from end of March to middle of April as the first phase, and then phased unlocking running across through the remaining part of the year. And during this process, all kind of new best practices and mechanisms were tried, like contact tracing, route mapping, new quarantine protocols, hotspot management, and work from home, staggered work timings were all global practices by then. But the most important aspect was the country with its third world public health standards responded quite robustly to tackle this thing, this challenge which was coming up as the cases were increasing across the country, spreading across the country, and by providing free and immediate clinical remedies, which even excelled many of the advanced societies, because we know cases about how many Western societies, despite having much greater medical public health systems, struggle with a manner, and in comparison, we did a much great job. So the fundamental objective of the nationwide lockdown, which was the core strategy, was supposed to be to flatten the curve and delay the inevitable, that is the effect of the pathogen spreading across the country. So in subsequent slides, you will see how the epidemical curve kind of went up, but in a very elongated manner because of these kind of measures which were quite effectively implemented. And like I said, by mid-April, after the first round of lockdown was over, the economy and the country was gradually opening up in a phased manner. The cases increased in a massive manner. And unlike like the statistics I have mentioned here, while it took 100 days to reach the 1 lakh mark, it took just 9 days to cross 1.5 and a fortnight to reach the 2 lakh mark. That's a national caseload. And just 3 days taken from 8 to 9 lakh. By July 17, or the mid of July, we had 10 lakh national cases, 25,000 deaths, and 36,000 per day.
Vinod, you might also like to tell them what a lakh is. That's 100,000.
Okay, so maybe, sir, due to the paucity of time, maybe that could be, of course, million and lakh, you had already explained. So the thing is, the cases increased in a drastic manner. So the numbers which I have given at the top are the per day numbers. It started by 20,000 by June. And by October, it crossed the 1 lakh per day, which was the peak of the pandemic. And by then, the unlocking was going on in a very steady manner. Then festival season in India was also coming around. So then a lot of people were out in the streets. And that was the case when this we achieved we went towards the peaking part. And that was also the time India was the third highest cases after US and Brazil. But then, of course, after the peak, cases started coming down by 50,000 per day by the first fortnight of November. But then even then our caseload reached around 84 lakh around that time. More than the effects of the economy unlocking and the economy getting back into full steam, it was also the effective nationwide testing infrastructure which was set up by the numbers which I already mentioned. And by August, we had the capability for conducting 5 lakh tests per day. But some of the gains gained in this was we had major recovery rate of over 60%, which I'll explain in the subsequent slides. And by the end of the year, cases were completely under 20,000 cases per day. I'll just give a small glimpse of how the elongated curve works. The flattening of the curve, the objective was achieved during this unlocking period, May to June, mid-June to mid-July, the kind of scale. And this was an overall picture of the total case load coming to around 10 lakh around late of July. So by this particular standard, we could confidently say this was a successful measure, because even at the beginning, it was kept at a very minuscule percentage of the population. And as the numbers shown in this slide, even in the current situation, when we had crossed 12 million cases, it only amounts to 0.88% of the total population. But and that's also again 1.3% of the total case load. However, this is only based on the numbers. But as you know, various sero surveys were conducted across the country based on antibody prevalence, and various surveys showed different results. Like the initial survey showed only around, I think I can't see the 0.73% in the initial days. Even the third survey in recent months also showed it was around 21% of the population would have been exposed to the virus. It's not actually infection numbers, but also exposed, because like has been the case discussed, there were instances of 70 to 90% asymptomatic cases seen across the country in various through different varying ranges. So even in some cases like Delhi, we had seen at least 50% of the people having seroprevalence, which raised to discussions of whether herd immunity is actually setting in. So this is actually the larger picture as we see today, starting from the beginning, and how the elongated curve touched to the peak, then came down, and by now we have a second wave actually happening through a steep curve. So what were the other measures taken? Disease control, I'm not going to go into the specifics because these drugs are pretty known to all public health and policy experts here. But the whole idea was though the fundamental strategy of disease control was to treat the symptoms of the infected patients, and there were also sufficient efforts made to repurpose the existing antiviral drug kitty in order to use this. But of course, you know, WHO trials showed out many of these were not effective. But the takeaway from this point is the pharma industry now has to really work towards an antiviral on this particular pathogen. Testing we had, like I said, it started from nothing, almost nothing, to almost with many technologies repurposed and developed, which I have listed in this slide. We have come to around the capability of 5 lakh, conducting 5 lakh tests per day. And that was also the reason why early detection and all these things were possible, and early treatment. A lot of field hospitals were set up across the country. So that managed this kind of curbing and containing this thing to the numbers which I already mentioned.
You're in your last minute, sir.
Yes, sir. So this was one of the technologies which came in to help the accentuate this process, the rapid antigen kits, many other technologies I already mentioned. Vaccines, the story is already out. You all know what has happened on the global scene, the kind of players and all those things. So I won't really go into this other than, but to come to the Indian mission, which we started in January. You see the High Commissioner, our vaccines have already reached all parts of the world, but we also did this national mission on a very wartime scale, covering these numbers, which I already said, from the first phase, which started in January, covering health workers, to the second, which is ongoing right now. Close to 55 million doses have been served in this country. So our total strength objective is to cover 66.6 crore doses, to cover at least a quarter of the population. So and added to that, we are also giving to the international community. So these details are already known to the people. So coming to the second wave, of course, questions about community spread and second are still being debated. There's no clear definition on what is a community spread or a second wave. So some kind of categories I've already listed. But the thing is, the question is whether a second wave has already happened in the country or are happening in various pockets across the country. So right now we are seeing a spiral happening. The numbers I've given in bold here. So are we prepared to now learn the lessons of what we learned in the first wave to deal with the second wave? Of course, we have new variants also coming. I've mentioned the cases also, number of cases which have already been detected in this country. So probably the way we approached last March is not the way we would be approaching this March, because we are fully back into stream. The fully economy is back there. Elections are going on across the country. Festivals are back.
Last minute, sir.
So it is, I've done, sir, I'm almost done with. So the thing is, the three key things we have to remember is nationwide survival. And this applies to all nations, including Nigeria as well. Contagion mitigation exercises, which are templates for each country, each localities, and disease control protocols have to be quite effectively followed the way we did it in the first wave itself. That's where, sir, I ended. Thank you so much.
Oh, thank you very, very much, Vinod. That's very, very comprehensive. And basically, my take home from my own side of the story is that yours is the developing nation circumstance, but it was with a sophisticated world-class level response, that there is opportunity of national intellectual and industrial capacity, which help to upscale the institutional medical response capability. This is very, very important for us to understand that. But that in spite the national pressure to meet with the need of a clearly mapped out strategic plan to vaccinate and also medicate, that India fully recognizes its international support humanitarian responsibility. And this is where our union really comes to play. I am glad you were able to say this. At this point now, thank you. I will say thank you very much before we come to the Q&A stage. We shall now slide into the second segment of this session, which is strengthening the role of multilateral health institutions. And I am privileged to introduce Ambassador Manjeet Puri, who is a former Indian diplomat. Diplomats do not retire just do not leave the scene just like military generals. He has served as ambassador of India to the European Union, Belgium, Luxembourg, and Nepal. He was also ambassador, deputy permanent representative of India to the United Nations. In addition, he has served twice in Germany, Cape Town, Muscat, Bangkok, and Caracas. He joined the Indian Foreign Service in 1982 and retired by 2019 in the rank of a permanent secretary to the government of India. During his long diplomatic career, Ambassador Puri developed special expertise on multilateralism and the United Nations plus on plurilateral fora, having been involved in working relation to the G8, G5, and G20 summits. His foreign policy expertise also covers Europe, Nepal, Africa, Southeast Asia, the Gulf, and the Americas. He served as Deputy Chief of Protocol for 4 years, looking after heads of state governments' visits to India from overseas that gave him an extensive exposure to high-level governmental working in India and other countries. He has a master's in management and did his bachelor's of arts in economics from St. Stephen's College, Delhi. The next speaker after him will be Professor Nasidi, who is a medical officer, a virologist, and a biotechnologist. He graduated in the year 1977 with a master's degree in medicine for Kalinin University Institute, USSR, and acquired a master's degree in epidemiology in 1979 and a PhD in virology in 1983. He has had a lot of achievements, but I will just go down quickly that he was appointed as the chairman of the Presidential Task Force for Polio Eradication in 2008. And this task force developed strategies that led to the sharp reduction by more than 95% and virtual elimination of circulating wild poliovirus in Nigeria by the year 2010. His other achievements include the development of hepatitis B vaccine and snake anti-venom against the carpet viper. I'm sure that our Indian colleagues will be very, very interested in that. And while the Indians charm these snakes, we find vaccines for their bites. And 2 other Nigerian poisonous snakes. He initiated and organized the national response to the Ebola viral disease outbreak in Nigeria of 2014 and was appointed by the then president to coordinate Nigeria's Ebola response and also support the West Africa support to Ebola affected countries in West Africa. Without much ado, I will go straight ahead and call Ambassador Majib Puri to lead us before Professor Nasidi joins us. Ambassador Manjeev Puri, please.
Thank you very much, Brigadier Salebala. Can you hear me, sir? Can you
very, very clearly. I can hear you very clearly. Namaste.
Namaste. Thank you very much, sir. You know, I want to begin, of course, by thanking IDSA, Manohar, Parrikar, IDSA, as well as the Gusau Institute for hosting this very important discussion. I also, of course, want to thank my great friend and our High Commissioner, Ambassador Abhay Thakur, as well as Ambassador Sujan Chinoy, and of course, General Gusau for their presence. Sir, I want to start off by just making some very simple points. Never before, not just in our times, but perhaps never before has the world been struck by something of this kind as the COVID-19, which has struck every country in the world. Every part of the world has suffered and taken hits in different ways and means. For me, this is an example of both the good and the not so good of globalization. I am therefore very glad that India and Nigeria, these are 2 countries which account for very significant percentages of the world's population, that we are coming together and we are large population centers in a democratic mode. And we also have certain commonalities from our history. Therefore, I am particularly happy that we are coming together and that this webinar has enabled an exchange among two countries, which I believe can make a pivotal impact in the world, not just in Asia and Africa, but in the way the world does things. Mr. Chairman, let me say this, that a certain element of the problem is not something that is right for me to comment on. How did the virus evolve? How did it get transmitted? Let me leave that out. But it is for me a matter of some or rather great disappointment that multilateralism and the world institutions that we set up, which are particularly important for the developing world, did not rise to the occasion. Now, whenever something very large and major happens, the larger stakeholders in the world, let's say the United States, European countries, they have the wherewithal to be able to manage things themselves. They too didn't do well. But for all of us, there is a certain reliance on multilateralism, on coming together. And it has never been stronger than in the case of pandemics, which actually demand that we pool resources together and do things together. Since we don't have the wherewithal, we didn't have the wherewithal, and we've been really, as they say, caught out in the blue. But I'm afraid the global system, the WHO and other institutional arrangements really didn't pony up. They were not there, perhaps, and they were not even there that after things got announced, were they in a position to tell you, here are the right standard operating procedures. If you do this, this is what will happen. In a sense, we have seen them too groping in the dark. But I can understand this. Never before has something of this scale happened, and never before has it struck in such a large scale in that part of the world, the developed part, from where we expect that we get ideas, we get solutions, which we are then able to multiply and set forth in the developing world. Having said all this, Mr. Chairman, I'm very clear in my mind. It means we need better multilateralism. And I'm not going to go into the entire gamut of multilateralism. I want to remain focused in the area of public health. For me, this is particularly important in the present time. I can talk about reform of the Security Council, the changeover in the structure of the Bretton Woods institutions, but let us remain focused on what we are looking at. What can we do in the current pandemic, and how can we ensure that we are not struck with such a major catastrophe in the future, especially in the area that is particularly important for us, which is the area of our own health, the health of our children, our families, and in general, the global public health. I have 3 or 4 points, and I want to thank Ambassador Abhay Thakur for having already drawn attention to something which, of course, it disappoints me, is unlikely to take off, which is the Indian and South African proposal for relaxing the IPR rules in terms of vaccines so that they could easily become available in the world. But I'm not surprised that this doesn't seem to be taking off, because if you remember, several months back, when the World Health Assembly met, the biggest and most important countries in the world did not agree even to certain elements on trying to set up a commission on where the COVID virus came from, etc. Basically because tagged along were issues about making vaccines global public good. Now, I must say, India and the European Union agreed on that, and we put it out in a joint statement. But having said this, I am glad that something that your country is contributing in a huge manner, Mr. Chairman, in the form of the Director General of the organization which perhaps matters among the most right now, the WTO. We are seeing that she is prodding people to let at least the second phase of this thing go forward in terms of licensing enough capacity of these newly innovated drugs so that vaccines could become available across the world. We have seen this happen in the past. I myself recall the case of bird flu. At that time, Tamiflu was supposed to be the answer, and nobody was willing to let it go through even compulsory licensing. Indeed, in India, it took several years for the Supreme Court of India to allow its compulsory licensing only as far as India is concerned. So I understand where the world comes from in the world of IPRs. But what I'm very happy to see is that the new DG of WTO is taking steps to try and see what best can we do while recognizing the importance of IPR, in any case, recognizing that those who have them are not going to let them go so very easily. And the rest of us need their innovative skills as we go forward to do other things. This, for me, is one of the most important, not just immediate, but challenges for the future. How do we manage to engineer a system that we lay out ways and means by which the best and the finest IPRs are available, certainly for those who innovate and for them to make profit, but they are also available for the greater good of humankind. This is where, in my opinion, multilateralism comes in. The UN, the Secretary General needs to play a role. The DG of WTO and WHO needs to play a role, and so does the World Bank. But above all of us, especially those of us which are major countries, we need to pull our weight. It's great that my country and South Africa have proposed, but we and Nigeria, a very important player in Africa, we need to come together, throw our weight behind such ideas so that we find via medias which ensures that what the WHO DG had said some time back, that, wow, this is fantastic. There are some countries which have all the vaccines, and we noted that one country had received only 28 doses. I must tell you, I participated in a number of webinars on this subject, but hearing that little expression that one country, no matter how small, had received only 28 doses, it really sank my heart. And I don't think any of us are made of metal which allows us to stomach something like that. This, for me, remains the most important thing that needs to be not just a takeaway, something which we should do now and make it an institutional framework, because globalization is here to stay, and with it, the negative aspects, including pandemics, and we need to try and prepare ourselves for a better way of tackling things in the future. This also includes the organizations working much more in terms of standard operating procedures, ways and means of helping those who need the help and take things forward. You know, my colleague just now read out to you in great measure the steps that India took in terms of acting against the COVID pandemic, both on the health side, on the economy side, on the vaccinations, PPEs, etc. But if you recall, he started off by saying that we frankly didn't know what was happening. And who do we turn to? We want to turn to organizations of which we are members, which are global, which pool together the best in the world. Of course, we can turn to the best countries in the world too. But this was, of course, a standard case, a sad case where they themselves were groping. But we should ensure that we are not in the business of groping, and that we have futuristic thinking, planning, and that our multilateral organizations are really up to scratch so that we are never again caught unawares in this sense. For me, therefore, other than this capacity building thing, this willingness to act together, there is one more dimension to it. And that dimension is that of research and development. Now, IPRs has been for a long time the bane of doing collaborative work. Other than agriculture, and that too in the wake of the Second World War, when there was a kind of certain magnanimity in the world, we allowed the development of agriculture such that international institutions came up, which allowed the development of agriculture, seeds and production methods, which have benefited all of us, including my country. But we've been
in your last minute, Ambassador.
niggardly. Yes, sir. I have 1 minute, sir. But we've been extremely niggardly in doing the similar things in terms of climate change, and now in terms of pharmaceuticals, drugs. We must work. I want to make one last point. My last one, of course, is about institutional changes at places such as the WHO, which involves governments much more, not just good technical people. This means that their governance structures must have permanent standing bodies of people who are empowered to do things and act. But now I want to make one point to you. We need to work on the legislative side. We need to ensure that we are having legally binding conventions which ensure that countries are told, the entire world is told at an early stage whenever there is the outbreak of any such pandemic. And of course, if it means amending the various treaties dealing with biological and chemical weapons, so be it. That should also be there. So I would like to stop now and say collaboration R&D, ensuring that we see that our fruits of success, the vaccines, get available to humankind. We look at ways in which we can strengthen these institutions, because no matter that these institutions did not do a good job, these are the institutions that we require for the future, and their well-being and their strengthening is extremely important for us. Mr. Chairman, thank you very much.
Thank you very much, Ambassador. You know, I wish I can give you an hour, because I really am enjoying every aspect of this. And you being an ambassador and me being a general, it only reminds me of the Tom and Jerry relationship that goes on in the embassy between the head of chancery and the defense attaché. I know.
Very well said. If you notice, the head of chancery and our military attaché were sitting behind the ambassador.
This is deliberate.
Well done, sir. Well done. Thank you.
Well, my biggest take home is the fact that multilateralism received a shock by the overwhelming disruption of the COVID-19 emergence, and humanity, including the international relations network, reclused to self-preservation. And this is what has gave birth to medical research and vaccine nationalism. This is why I agree with your last very strong point, that we need legislation which will ensure that even certain treaties are revisited so that humanity comes first. Because just as democracy in our various nations put human security foremost now in the new paradigm of security, that the citizen is ahead, so also is the regional, continental, and global citizen. But you asked a very critical question, which we should leave with, is how do we engineer a system where business makes its profit while humanity survives? I think this is very, very important, because I don't know how to put it out there, but there is a Nigerian saying that where somebody walks is there he will eat. So we need to keep our businesses alive, yet we have to be alive to keep those businesses alive. Thank you very much, Ambassador. We would have gone to our next speaker, but he has certain challenges. So I will cede this time and go back to our overarching chairman, who will lead us to the next session by the program, which otherwise we will call on Professor Nasidi to probably speak at the time he is able to join after we've dealt with the technical issues. I must thank Ambassador Sujan Chinoy and the speakers for the privilege, and I would like to cede the session back to him so that we get into the next session. Thank you very much.
Thank you very much, Brigadier General Saleh Bala, for having led us so efficiently through the first session. And what you ended with is something that reminded me of what Mahatma Gandhi had said about the 7 deadly sins, one of which, as Mahatma Gandhi had said in his book, Moral Sentiment, I'm sorry, not his book, but what Mahatma Gandhi had said was that commerce or business without morality or ethics leads to a system which is to the detriment of humankind. So that's one of the 7 deadly sins also, to conduct business merely for pecuniary gain, profits. Friends, this brings us to session 2, which is focused on emerging India-Africa cooperation. And the chair for this session will be none other than our very dear colleague, Vice Admiral Shekhar Sinha, who is also a member of the Executive Council of our institute. So may I request Admiral Sinha to kindly assume the chairmanship of the next session. Over to you, Admiral Sinha.
Thank you, Director General. and thank you, Gusau Institute, for this opportunity. My own introduction has been given by the Director General. I'm an Executive Council member of MP-IDSA, and I have two distinguished speakers with me. One is our own IDSA colleague, Ruchita Berry. She is a Senior Research Associate and Coordinator, highly qualified on issues of Africa, Latin America, and other parts of the Indian Ocean region. She is also the President of the African Studies Association of India, and she's been in the IDSA and writing and coordinating these meetings and conducting these meetings for many years, over 30 years. Rest of the intro, I think it's already given in the the pages which have been given to everybody. And our second esteemed speaker is going to be Excellency Emeka Izeze. He is the fellow of the Weatherhead Center for International Affairs of Harvard University. He basically in mass communication educated background person with a double sort of master's degree. He has been to, he writes for large number of magazines. He was also the editor-in-chief of the Nigerian sort of edition of the Guardian newspaper for a very long time. So I will leave that here, and if I have missed out any of the important milestones, please pardon me. It is all mainly because of the paucity of time. Now let me take my 5 minutes of the intro of the subject. Well, first of all, let me mention that as we talk here, the 23 countries have backed a treaty plan to fight future pandemics. The leaders have signed a memo, which is also backed by WHO, because it is believed, and rightly so, that these kind of pandemics are here to stay, and some more will happen in future. And it is not in the domain of one country to really take on all this and vaccinate everybody. And you just heard India's initiative in giving vaccine to so many countries, and I am told that the 60 million doses have been dispatched to various countries from India as the initiative. Now coming back, that we need to view the emerging sort of India-Africa cooperation in the framework of very quickly changing the global order. We are witnessing the multilateralism under cloudy weather, though with the Biden administration's arrival, and as somebody said, because of the COVID, it seems that it is not really on life support system, but some kind of multilateralism might just begin. It's not dead completely. Here, India and Africa need to maintain a very middle path, because when the global order is changing, it is quite possible that you are supporting one or the other. And that should be avoided, because if we get into that race, then you will find that doing the development and prosperity will take a second step. And therefore, and this is what India means by saying strategic autonomy. We are in many number of coalition and partnerships, but we are not in alliance with anybody. And therefore, it is not mandatory for us to sort of go bandwagon into one country. Africa has already shown the way by adopting the Continental Free Trade Agreement, an example, as how a reformed multilateralism should look like. Today, out of the top 10 countries which are growing fast, 5 countries are from African continent. So that's a very positive side. Our joint challenge is to bring reform to United Nations Security Council and also UN, which accommodates or which takes into account this paradigm change in the global order which is taking place. Africa's development path has attracted many countries to increase trade and help African countries, in developing their economy. Another important area of partnership that we are going to look at more deeply are the area of security and defense. Here, the global order seems to be changing, or maybe it is changed. If Africa has to develop, prosper, it will need to combat violence, radicalization, and terrorism. It will be essential for substantial development. Like our Prime Minister has said, Sagar, which DG had mentioned, meaning that security and growth for all region. It means that if you want to grow, security will go along with it, and therefore you can't segregate these two. And he very firmly believes that the entire Indian Ocean region needs to, develop. India has, of course, we have contributed a great deal in Africa to the under the UN charter. Even now, there are 5,000 troops who are deployed. But the areas of future cooperation that I look at are the counterterrorism, the space technology, cyber technology, and many more. Capability building of the African countries. The Honorable Defense Minister has already offered the offshore patrol vessels, the interceptor boats, night vision goggles, what have you. I mean, it's there. And I think the opportunity should be utilized for your security services to do exercises whenever the Indian naval ships are in that area. As you know that we are very frequent visitors to both your country and Nigeria and Madagascar. We have our coastal radar stations which give you the traffic and white shipping data agreement we must enter into so that you become part of the Indian Ocean Fusion Center and you know who's coming and who's going next to you. So I'll stop here because there is much more to talk. There is Boko Haram, there is Al Qaeda. You have all kinds of trouble, not only in Nigeria, but other countries and neighboring countries as well. You got Chad and Niger, and you got your northeastern parts. They're all very badly affected by, and that is affecting the, shall I say, the progress of Africa. It should have done much more. Let me now stop here and invite Ruchita Berry to take on the floor and speak her part. You have 10 minutes, Ruchita.
Thank you, sir. Good afternoon, ladies and gentlemen. I am Ruchita Berry. I work on Africa at IDSA. It's my pleasure to be part of this important dialogue. And since we are talking about India-Africa cooperation, it is well known that India shares a very close partnership with African countries. And in recent years, India has visibly enhanced the level of political, economic, and economic engagement with the region. And particularly among the, within the current pandemic, India has continued to engage with the region in a big way. Now, in my presentation, I would talk about three main issues. First, briefly talk about India's development cooperation, then the health cooperation in past and in the current pandemic, and finally about the India-Africa cooperation, the security realm. Now, I would say that in terms of development cooperation, it is the main pillar of India's cooperation with Africa. And India has often reiterated that its development cooperation with Africa is unique. And it is based on African priorities. And it contributes to African development objectives through a consultative process. So the 2 points which are to be noted very carefully. First, that it is based on African priorities and it is through a consultative process. It is not something that India is imposing on the African countries, the development partnership. The other important aspect of India's development cooperation is that Africa as a whole is the second largest recipient of India's development assistance after South Asia. To throw you some figures, India has completed about 194 development projects in 37 African countries. And they range from infrastructure to IT to power generation to distribution of water and irrigation, railways, roads, agriculture, sugar plants, and health. So given the current pandemic, the focus has been on health, but health cooperation is an important area of India's development cooperation with Africa. And over the years, I would say that India which is well known as the Pharmacy of World, has provided low-cost generic drugs to several African countries to combat HIV, AIDS, TB, malaria, and other infectious diseases. This was mentioned in the earlier session also. And the Indian firms like Cipla, Ranbaxy have supplied medicines, including those for HIV, AIDS treatment to African countries at a minimal cost. In fact, in my various interactions with the African counterparts, we've come to know that it's almost 1/10 of the cost of what the big pharmas have been selling to the African countries and other developing countries in the world. So, so India has been supplying low-cost generic drugs to African countries. The other important initiative that India has launched in the health realm is the Pan-Africa E-Network, which was first launched in 2009. And recently it was relaunched as E-Vidya Bharati and Arogya Bharati project in 2019, which connects hospitals in 54 countries in Africa with medical practitioners in India to provide consultations and comprehensive telemedicine training opportunities for African doctors, nurses, and paramedics. This is what was happening in past. I've just given you a glimpse of that. But the pandemic brought in an important aspect in terms of exchange of information in the management of pandemic between India and the African countries. We are very well aware that African countries themselves launched a very robust response to deal with the pandemic, with several innovations coming out of Africa. And this is very much evident in the fact that Africa has fared very much better than any other parts of the world a year after the outbreak. And this is, I would say, mainly due to the African countries' past experience in dealing with pandemics. They had experience with Ebola and other pandemics in past. So now the challenge that India faced was during pandemic was given the fact that it has a 1.3 billion population of its own, but the country took the initiative to support its partner countries during the pandemic, and it has been in the forefront of supplying medicines and generic drugs to other countries, including from Africa. And India has helped this by also offering training through various e-ITech courses to the African countries. Another aspect of India's health management and support to the African countries has been the role of Indian Navy, which has helped in implementing India's health cooperation with African countries. And you found that under Mission Sagar and Mission Sagar 2, the Indian naval ships sailed to various Indian Ocean littoral countries in the continent to provide medical assistance during the COVID pandemic. So these early responses during the pandemic were followed by India's drive to share the Made in India vaccine across the world. And this was mainly because of the inequity and the excess in distribution of COVID vaccine, which has left both the African countries and India equally aghast. And I would like to share some of the views of the African leaders, specifically President Buhari of Nigeria and Ms. Ngozi Okonjo-Iweala, the former Nigerian finance minister and the current WTO chief, who have drawn attention to the problem of vaccine hoarding and vaccine nationalism by developed countries. So India has constantly raised its voice against vaccine nationalism along with the African friends, and supported initiatives calling for international cooperation to ensure global access to vaccine. And so the Vaccine Maitri initiative has, through it, India has offered free COVID vaccine or at marginal cost to countries around the world. And as the largest vaccine producing country in the world, I think this is something which India could do so. It has supplied it through three mechanisms. One is in terms of the commercial mechanism. The other is through the COVAX facility, and the third is it has gifted the vaccine to some of the partner countries. So I feel that the pandemic provides a fresh opportunity for India and Africa, particularly countries like Nigeria, to collaborate in joint production of things like medical equipment, generic medicines, and vaccines in future. The modalities can be discussed by the experts in future. The third important aspect in terms of India-Africa cooperation that I would like to talk about is security. And you find that both India and the African countries like Nigeria face common security challenges such as terrorism and maritime insecurity. And the COVID pandemic has not helped, and it has in fact presented opportunities, particularly to the terrorist organizations, to consolidate and expand their operation and territory as the governments focused on public health crisis that they were facing. So you find that in sub-Saharan Africa, the pandemic led to the increase in terrorist activities across the continent, from Mozambique to Sahel to Horn of Africa. The groups like Al-Shabaab, or within Nigeria, Boko Haram activities have been increasing every day. So apart from terrorism, I think the maritime challenges, which are very well known to all, things like illegal fishing, maritime crime, and piracy, have increased in the West African coast in the recent years, particularly in the Gulf of Guinea region. So opportunities exist for both India and African countries to expand their security cooperation. As you're aware, India's security cooperation with the African countries has hinged on training and capacity building and on peacekeeping training under UN rubric. But I would like to point out that in recent years, Prime Minister Modi has evolved a philosophy of Sagar, which talks of security and growth for all, and that recognizes the symbiotic relationship between security and growth. And this philosophy is echoed in the long-term plans which the African countries or the African Union have brought out, such as the Agenda 2063. Therefore, India and Africa both recognize that security and development go hand in hand. So if you talk of security cooperation, it has to be a development-centric security cooperation between India and Africa. And here I feel in Nigeria as an important regional partner and old friend can help in shaping India-Africa cooperation agenda and for future. And the role of think tanks such as Manohar Parrikar Institute for Defense Studies and Analysis and Gusau Institute is also important. Greater frequency of interactions such as the one just taking place today, exchange of scholars in post-pandemic period, will help in greater understanding between India and Nigeria of the challenges faced by two countries, and also help in developing a roadmap for future cooperation. I would end by giving you a brief example of how countries in Africa like Nigeria and India have forgotten some of the indigenous things which have been there in past. I can talk briefly about a superfood which is becoming very popular across the world, and countries in the West are trying to patent it, which is Moringa, or what is known as drumstick in India. So both India and Nigeria are aware of the positive health benefits of Moringa. It is a local production, but we haven't gone vocal on the local indigenous products. So I think the way ahead for future for both India and Nigeria is to push for local development, indigenous products, go vocal on local, as Prime Minister Modi has talked about. Thank you. I end here.
Thank you, Ruchita ji. I think there are many takeaways from your talk, beginning with the development projects which are going on, where all we can move in that direction, which is more for the human development and daily usage. And that, of course, included the health cooperation, which is already in progress. Arogya Bharati you mentioned about, and also the connectivity of the Indian doctors, specialists, with 54 sort of medical, shall I say, organizations in the African Union. So that's a very good thing that you have brought out. And I think this needs to be expanded to larger number of, shall I say, the terminals at the institutes like AIMS, or maybe the private hospitals like, you have the Scots and Medanta and some institutes in Bombay. So that is, pandemic has really brought in a new area. And I think that healthcare and pharmaceutical will become one of the strategic weapons of future, and not only armed forces. And I think that anybody who controls the pharmacy, and as much as he can distribute, it certainly helps in bringing goodwill between the countries. And I think that this is another area. Thank you. Good talk. May I now invite Excellency Emeka Izizi to give his outlook. Sir, you have 10 minutes from now.
Thank you very much. I'll try to be briefer than 10 minutes. I see our time is running. I just want to draw attention to the relationship between India and Africa, particularly India and Nigeria. Nigeria was not independent when India stepped and made its presence known here. India opened its first mission in 1958, 2 full years before Nigeria became an independent nation. So the ties have been very close over these years. And what has been surprising is really the fact that not much has been made of that relationship besides the known areas. Nigeria is India's largest trading partner on the continent of Africa, and India is Nigeria's largest trading partner globally. And yet, you don't get a sense of that by listening to Nigerian Indians talking, because if Nigeria is this large recently, is large with India. We have virtually equal population. Africa, like this, we don't really have much ways to India on the continent of Africa for help. We are facing
there seems to be some issue with the audio. Honorable Chair may kindly look into this. The Honorable Speaker might like to note that there is an audio issue. So if you wish, you can mute the video so that the available bandwidth is diverted to the audio. With the permission of the Chair. Thank you.
Very good.
Is it better now?
Yes, we can hear you now.
Okay. So I was saying that at the time in which we live, we really have no choice than to turn to nations like India for help for Africa's needs, especially on matters such as we're discussing. The Europeans are not going to come to Africa's help anytime soon. The Americans are not going to come to Africa's help anytime soon. And gratefully, the pandemic has not been as tough on Africa as was expected. Otherwise, the response would have been terrible. So I think that at a time when multilateralism hasn't quite worked well, that there is still no elbow room than for nations such as Nigeria and India to seek new ways to deal with issues such as we're dealing with now, the pandemic of COVID-19. And our relationship is long-standing. Let me just summarize what I have in mind. India had done it before, and it can do it again in the area of vaccine production. There is no reason why we can't begin to explore code-sharing arrangements. India had done generics in the past. India is already doing generics now, and we do it, and Africa would do well to turn to a nation like India for those vaccines to be readily available. I also think that export arrangement, import arrangement of vaccines and other pharmaceuticals should also be explored between Africa and India to ensure that we don't run into the kind of difficulties on the continent of Africa that many people fear sooner or later we'll have to get into, because we can't continue to have a continent of 1.3 billion people simply vaccinating less than 1 million people, and people are just taking it as a normal way of doing things. It is not. We turn to friends like India. How can we strategize and improve on import and export arrangements for vaccines and similar products? I also think that we should be leaning on India, going away from medical area. We should be leaning on India, which has a long experience in dealing with insurgency and terrorism. And can we find new ways of addressing this? Barry just mentioned Mozambique. Actually, on the continent of Africa, no fewer than 20 African nations have one form of insurgency or the other. And people are simply fatigued in attempting to help Africa with such matters. India may well be the place to turn to, because India has an experience in this area, and because insurgency is not new to India. And India, as the ambassador said at the beginning, and say a country like Nigeria, have similarities in ways of conducting their affairs. And so I am proposing that this is an area that can be explored. I also think that in the area of cyber security, India has an illustrious track record in cyber security and digital economy, digital diplomacy. And Africa will go much faster by turning to a nation like India, which has similarities with Africa in this area, because then we're not going to have other nations who are hoarding resources to deal with, say, cybersecurity, or resources needed for the digital economy, where India is one nation that is needed by Africa at a time like this. And I am sure that if we explore this, we will find more opportunity, more synergy between India and Africa, not just in the regular areas of relationships, but in this new area that would define the world in which we live, climate change. Already it's been defined by your Prime Minister, the Indian Prime Minister, Mr. Modi. Is one of those 10 points that he wants to be able to have at the end of the day, saying this is an area in which we related well to Africa. And we look for, because we're going to face it, we're going to look at issues of water. They're going to come and become major issues on the continent. So I think the scope is so wide for improvement in relations between Africa and India, and Nigeria and India. Thank you.
Well, thank you very much, Excellency. I think you have really defined what is called timekeeping. I couldn't keep time myself. So thank you. I think you have made a lot of very, very valuable points. And I hope that it gets reflected in the summary that we make here at IDSA. I'm sure the DG is watching and listening to this. There will be a summary of this, and we will, IDSA normally shares it with the partner organizations, and we will see that how it can be pushed to the desired levels. But you know, the defense ministers conclave has very clearly laid out that in the defense production, you know, there will be a fair amount of progress. Today, the two NSAs have met, the Nigerian NSA and the NSA of India, Mr. Ajit Doval, and I'm sure that they would have discussed counter-terrorism in this. You're right in saying that we have got the terrorism and insurgency both under reasonable control. I would say there are more than reasonable control by whatever practices that we are following. Cyber security, yes, I mentioned during my covering talk that both cyber and space, these are something in which we can do some fair amount of work together. Having a sort of production line of pharmacy in or any vaccine in Nigeria, it's a very good idea, and I think that it is doable. So I think once we get a little bit of handle on the pandemic, you know, little more, because as you know, the second round is just looks like it's here. Once that is under control, I am sure that government of India will look into this to produce these vaccines and other pharmaceutical products in Nigeria. And once again, I'm sure that the DG and DDG are making note of this. So what I'll do is I'll stop giving my sort of views on this. I only summarize what you have said. Climate change is another issue, water another issue. So there are many of these issues which are futuristic in nature, and there are some which are very urgent and current. So I'm sure that the current things will get addressed first, and futuristic thing will be done together. So I'll stop here and hand over the reins to the Director General, what is called the real master of ceremony.
Thank you. Thank you very much, Admiral Sinha, and for having so very graciously conducted session 2. Again, a very important session, and I'm glad that you ended with your own remarks about the great potential that exists in India, you know, taking its pharmaceutical industry across to Africa. So I think we'll all work on that, and you're right, we will definitely, you know, cull the main points and list them for follow-up action. We certainly don't want this to be a one-off event. We want to engage the Gusau Institute and our Nigerian friends in, shall we call it a sustainable long-term dialogue. So now, ladies and gentlemen, friends, we come to the Q&A session, but I see that there are no questions, such as the profound ground that has already been covered, and so many issues have been mentioned that we've actually answered many questions that might otherwise have arisen. But I will not let you off so very easily. And so the limited time that we have before us, and I say this in full knowledge of the fact that we have already exceeded our time, I wish to use that limited time to actually throw it open to the panelists themselves, in case any of the panelists of session 1 and session 2 wish to comment on what has been said so far. And I will, of course, fully understand if you do not have anything to add other than what you've already said. So may I quickly run through this, and thereafter we move into the last and closing session. And I will not exclude the chairs, of course, because the chairs have equal right. The two chairs who have so very effectively conducted the two sessions will also have a chance to chip in. May I begin, therefore, with Brigadier General Saleh Bala, a quick soundbite from you, if you wish to add something to what has been said so far. I mean a quick soundbite, really.
Well, thank you, sir, for giving me this opportunity. My emphasis has always been that we come from a common humanity, and that we propound intellectually and philosophically for all the opportunities our various gods have given us in order to have a global community. That COVID itself is a test on how humanity can unite. Because as a Muslim, I am taught that my Almighty Allah created us in different races and beliefs in order for us to understand ourselves better. And I am sure this philosophy is in various of the well-founded fundamental religions. There isn't much to add from my little bit. I am not quite a soundbite person, but I believe that the relationship that has been built between our two institutions has nothing in it but growth for the betterment of humanity and indeed for our two great countries. Your nation, which is a continent by itself that I so respect, and Africa itself, the most populous Nigeria, the most populous African nation you can find, and indeed the throat of Africa, because if you look at the map of Africa and you grab Nigeria, it means you grab the throat of Africa. And it is think tanks like ours that will be able to churn out ideas that will make our democracies flourish the better. Thank you very much for this opportunity, sir.
Thank you very much, Brigadier General Saleh Bala. I fully echo all the sentiments that you just expressed. May I now request Dr. Nasiru Sani Gwarzo for a few comments, please. Dr. Nasir Sani Gwarzo, in case he's there with us.
Yes,
right.
Very sorry, I missed that point where you spoke.
I invited you to make a few brief remarks or comments in case you wish to on anything that has been said so far.
Yes, thank you very much. I must say that I enjoyed every bit of this program, and I think it's something we should look forward to repeating in different subject areas, but particularly I want to draw on the immediate benefits that can arise out of this. There are low-hanging fruits, and some of them include the need for us to come up with an agenda beyond this meeting. We shouldn't just disperse as a talk shop. As soon as we are over with these discussions, let's put an agenda of action that can bring benefit to the two countries. One of those low-hanging fruits is the manufacture of vaccines. We don't have to start with the highfalutin ones like Corona, but we have, for example, Professor Nasidi. I wish he was here to speak. He has patented a very good, potent anti-snake venom that can be produced, but he has to go to UK to produce it. And of course, you know the implications of producing in UK. The cost implication will be higher. If it was a partnership with India, that product would have been in the market. Then we also have other APIs. The current challenge we face in Nigeria of APIs, active pharmaceutical ingredients, is a very real one. And with that, it's affecting every pharmaceutical industry. We have the raw materials to produce it. All we need is the technology and the partnership. And I believe within a short time, we will turn around the industrial sector, the health sector, and every other sector with this partnership. I think this is the unique opportunity that we must take and run with. Thank you very much.
Thank you very much, Dr. Nasir. And I just wanted to remind you that at the start of the pandemic, India itself was in a similar situation as Nigeria found itself to be in, which is to have this enormous dependency on external sources for its own APIs. So APIs is something that India is also focused on in light of the pandemic and the disruption to supply chains. And so we really understand what you are saying here about the difficulties that Nigeria experienced as a result of the disruption in imports of APIs. We've been through that and are likely to face similar problems unless we ramp up our own API production. May I request Mr. Vinod Kumar to take the floor here? And before you do that, let me do justice to our participants from the audience. Mr. Kayode Garrick, he has asked, or rather commented first. He says a large segment of the Nigerian population appears to be increasingly averse to lockdown and other restriction measures. But well, you could actually say the same thing for India as well. Many are also unlikely to agree to be vaccinated. Is this also the case in India? How can we evolve strategies to persuade our entire population to cooperate with restriction measures and to accept the vaccines. Vinod, may I request you to have a go at that? And later, if any other participant also wishes to comment, the ones that will follow. Over to you, Vinod.
So I don't see him there, sir.
Okay. All right. In which case, I will request at this stage Ambassador Manjipuri to kindly comment on what Mr. Kayode Garrick has said about this general aversion to obeying guidelines and restrictions for lockdowns, which doesn't seem to be uniquely attributable to the Nigerian people. I mean, we can see it in India and elsewhere around the world too, and about the doubts and anxieties that people still harbor with regard to efficacy of vaccines. What should we do together to spread the good word about cooperation, about the need to follow restrictions and take the vaccines as soon as possible? Ambassador Manjipuri. Could you please unmute your mic, please? Thank you.
Can you hear me now? Can you hear me? Yeah. I want to thank you, Ambassador Chinoy. I want to thank you very much for this excellent webinar. You know, India and Nigeria are, if you don't mind my using this expression, alternate powerhouses in the world, other than the developed world. And when we come together, I think there is a lot that we bring to the table for ourselves and for the world. And so this initiative of yours is particularly exemplary, and I must thank you as well as your partners in Nigeria for this. In my opinion, COVID is not what everyone says and has done, i.e. lockdown, social distancing, etc. Well, that's what we've had to do because we didn't collaborate. But COVID is really a sign, an indication, a segue that please collaborate, please do it across the world, because you need to collaborate even when you are faced with the greatest and most difficult of challenges. Now, I like the question which was posed by one of the members, the audience here. Look, for a variety of reasons, at least I am a convinced believer that the term social distancing would have been better had we used the term physical distancing. Human beings are about social interactions. Anyway, that term happened. We've tried to do a number of things. Lockdowns are difficult for people because they affect livelihoods. They affect your abilities to go about doing things. And so therefore there is an inbuilt resistance to it. But you know, this is what governments have to do. And when the message is that this is for your good, then people slowly but surely internalize it. Now, as regards the fact that people are hesitant to take vaccines, this isn't a new thing with the COVID vaccine. With the COVID vaccine, there's been so much debate on television that I would imagine that most people would be more convinced of its correctness, its efficacy, than, let's say, with the large number of vaccines which have come about in the earlier days, where a large number of people in the world felt that they would have X, Y, or Z side effect. What we need to do as governments, or rather what governments need to do, is to instill in their people the sense of well-being on the vaccines. We need to be more transparent. We need to tell people of the results, the fact that there has been an accelerated process. Well, it is a unique time, a unique situation which has brought us together, but aren't we being uniquely innovative in being able to find answers? We need to convince people that what we are doing is good for them and that there is no reason for hesitancy. In any case, I believe in a very simple dictum. No matter the efficacy of the vaccine, any vaccine is better than no vaccine. Please go ahead and get yourself vaccinated. Thank you.
Thank you, Ambassador Puri. And of course, it'll be the responsibility of role models in society, politicians, the celebrities, to come forth and support the cause of the vaccine, leading to better health for people around the world. I now turn to Professor Nasidi Abdul Salami. Is he with us? would he like to chip in with his views? If not, may I jump to Admiral Shekhar Sinha, the chair of the second session, if he would like to contribute a few additional remarks.
Oh, yes. Thank you very much, DG. There are 2-3 points which I want to make. One is a very good point was made by one of our esteemed speakers that they don't expect EU and Americans to go whole hog in supporting the African Union for any of these new development areas. So I would think that this gives a better opportunity to India to pitch in, because we are great friends with Africa, particularly Nigeria. And I do remember that while doing National Defense College, we have had 2 officers, one from the Army, one Brigadier General, and one captain from the Navy. And their procedures and everything that they follow, because we were all very good friends, they're very much alike. There are hardly any differences in any procedures that the 2 services follow. And therefore, I think that even the training at the ground level, it should be much easier for us. That is number one. The second point which I should have made with Boko Haram, that they are basically the Islamic State of Iraq's branch. They are what they call is the Western Front or the African branch, West Africa branch of Al Qaeda, and therefore eradicating them. And what they do is they capture the people and they start radicalizing them and sort of make them into big sort of terror facilitators. So I think that here the de-radicalization process that we have followed here, maybe that the 2 countries can share those, and to a very large extent we have been successful, and the result of which is being seen in the Jammu and Kashmir, which has been now turns into 2 union territories. So the J&K Union Territory, as it is known now, we have got a fair amount of handle on the radicalization and the terrorism which was going on. So I think that this model of post the abrogation of Article 370 of Indian Constitution, I think that we have a very solid ground to exchange this information with the Nigerian security agencies, and if required, give them actual help by our sort of mentors of these, by being in that country and emphasizing as to how these operations have to be carried out. Enough has been said on the pharmacy, etc. I think that that has been very well taken, and I think that sooner we do it, better it is. Thank you, DG Sahab. All yours.
Thank you very much, Admiral Sinha. And I quite agree with you. In fact, at our institute, we have a well-equipped, newly opened Center for Counterterrorism and Counter-Radicalization. And if the Gusau Institute is so inclined, we could perhaps consider another webinar in the near future, not too distant future, wherein we can actually focus on a theme related to counter-radicalization and exchange views about your experience in Nigeria, our experience in India. So I will leave that thought with the 2 sides, as well as with the High Commissioner of India in Nigeria to follow up as an outcome of this particular webinar. I would now request Dr. Ruchita Berry to chime in at this stage.
Thank you, sir. It's been a very interesting discussion. We've covered a lot of ground, and there are new ideas which have come up in terms of how to take this cooperation forward. I would like to talk about 3 things here. First, as has been mentioned, Nigeria is the economic powerhouse of Africa. It is the leading economy. It is the #1 economy in Africa. So who better to talk about how our India-Africa partnership can move forward? And I've also noticed that in terms of Nigerian development plans, the focus has been on moving towards inclusive and sustainable development, which is for all. And this is exactly what Indian policymakers have been focusing on, that the development should be inclusive, it should be sustainable, and it should be for all. the motto has been Sabka Saath Sabka Vikas, that the development should be for all. So I think India and Nigeria share the similar thoughts in terms of how to take the development partnership. And since health partnership is very important within the larger development partnership, I think this would be a way of taking this forward. And here I would like to point out that during the last India-Africa Forum Summit, India had specifically kept aside or come forward with an initiative of a $10 million India-Africa Health Fund, which was supposed to cater to some of the African countries who have financial difficulties in dealing with their health issues. Here, again, while looking at what is happening in Africa and the kind of challenges they face in terms of the vaccine development, one of the grievances or the challenges which our African partners have pointed out is the lack of funding for development of these vaccines. So India could, in future, think of expanding the current health fund to include funding for vaccine development. Secondly, I think energy cooperation is something which is very important between India and Africa. And we could, what the African countries, particularly countries like Nigeria, are interested more is cooperation in infrastructure development, energy infrastructure development. That is something the private sector companies between India and Nigeria could discuss maybe in the next business conclave, next India-Africa conclave, business conclave that takes place with the chambers of commerce like CII and others. And finally, this is a very good point in terms of cyber security and space technology cooperation. This has come up several times in our dialogues with African countries, and the Nigerians, our partners, have also mentioned this. So I think given the fact that a large number of countries in Africa are faced with the digital divide and the kind of experience that India has in the realm of cybersecurity, we can share our experience. Now I see that Professor Dr. Abdul Nasidi has joined us. So maybe we can give him the floor now to make his presentation.
Yes, indeed. Thank you, Ruchita. And of course, please remember that you will personally pay a big price for having said so many things, because I expect you at the end of the day to, as you have so very nicely done for this event, you will have to pick up all these themes and follow through. So I will hold you to your word on that, rest assured. At this stage, Professor Nasidi Abdul Salami, would you like to say a few words, please, on all that has just been discussed?
Yeah, I have to apologize profusely. I actually do my early morning sports every day. I wake up 6:30 a.m. to go either jog or play golf. And today I had a medical emergency. Somebody had problem and I had to support him. So I just couldn't connect early to listen to what you are saying. But nevertheless, I will have details maybe from the proceedings of the meetings. And at the same time, I already have my presentation, which I will make available. But some of the points I wanted to really touch on are the importance of strengthening, national public health institutions and the role they play in health emergencies and national and international health security. How to protect countries like ours with large population, and what we did in Nigeria to get Nigeria prepared, and how we fought Ebola successfully, and how we repurposed the instruments we had, using the National Public Health Institute, which is the Nigerian Center for Disease Control, which I established. That institute has now been playing key role in preparing Nigeria and now virtually most of the West Africa in highlighting our emergency preparedness and response. We started from, some states in the country not having even one MPH.
Speakers, please mute their mics, please. Yeah, go ahead, please.
In the early 2009, but as I'm talking to you now, we have virtually more than 300, MPHs all over the country, and the least state that will have maybe about 4 or 5, MDs with MPH. This has pushed us a lot and improved our preparedness to respond to some of these emergencies. Yeah, so those are the points. The point I wanted to emphasize was strengthening, the tools that will empower our nations to fight health emergencies, the types we are now seeing, and what is it that we need to do to network and empower ourselves, to be self-sufficient in some of the products that we need to fight these health emergencies. We have a lot to learn from India. You are already ahead of most countries in the world in terms of preparing your nation to be self-sufficient in drugs, in vaccines, and we are very grateful to Indian scientists for actually doing the generic HIV drugs that help many African people with AIDS, and empowering us to have access, to cheaper antiretroviral drugs. So also is the role played by India in terms of, preparing our world, the so-called developing world or low income and middle income countries, and to showcase that we can do it. And India has done it big, and now we are all using the Indian-made AstraZeneca. That's something we should learn from. But India also has a lot to learn from us, because we have developed new, mechanisms to prepare nations to fight these diseases, which I will present in my presentation, which I will send later. For instance, we developed a very expressive and interesting software, to do disease surveillance, which is now being used by many countries in the world. We also have candidate vaccines, and we are now working to see how we can partner countries like India, to start manufacturing vaccines and biologicals. We are producing other biologicals, like we have anti-sera against Ebola, we have anti-sera against snake bites, and so on and so forth. So we also showcase the use of the Nigerian Center for Disease Control, to position Nigeria in such a way that we reduce our dependency on foreign aid, especially during emergencies, when our response time should be small. And now, having such a national public health institute in place, it went a distance to improve our readiness and also reduce our response time. And this has been showcased worldwide. Thank you very much.
Thank you. Thank you, Professor. And you touched upon a very important point about ensuring the strength of healthcare institutions and systems. And I think there's no gainsaying the fact that healthcare systems everywhere around the world were overwhelmed by the pandemic. It didn't matter whether it was a first world healthcare system or a third world healthcare system. In fact, the wealth of the West did not protect the rich countries from the pandemic. We've seen that before our very eyes. And I think there are unique experiences that Nigeria and India have, which we could share with one another and with others as well. Thank you very much. Our last commentator is Mr. Emeka Izeze, please. Would you like to say a few words?
Yes, thank you very much. I think most of the points have been covered. Just to say that India must become more sure-footed in treading into Africa, and Africans must become more assured in seeking accommodation and in seeking cooperation and collaboration more and more with India, because I think that the future really lies essentially there. And we're not going to get it very much elsewhere anymore. And I think that India is a friend of Africa. India shouldn't look over its shoulders to think that Africans are turning elsewhere, but also come into Africa and become more sure-footed. And Africans mustn't just look away from India. Nigerians in particular should be having more collaborations like this, think tank to think tank, private organizations with private organizations in both countries, dealing with very difficult and very sensitive issues such as we have been dealing with all day. And I think that therein, in my view, lies the future of our relations and the future of developments on both sides. Thank you.
Thank you very much. You'll all agree that this was an afternoon well spent, that we utilized our time optimally. We had a wonderful harvest of ideas and suggestions that came up, but all good things must come to an end. And so also this webinar, and we are truly running over time. So we now move to the closing session, where I invite first my colleague, Major General Dr. Bipin Bakshi. He is the Deputy Director General of the Manohar Parrikar Institute for Defense Studies and Analyses, to deliver closing remarks on behalf of our institute. After that, I'll turn to his counterpart speaker from the Gusau Institute. Over to you, General Bakshi.
Thank you very much, sir. Thank you. And greetings of the day to all the panelists and the participants in this path-breaking webinar. As has just been said, we've covered a lot of ground today. We have recounted the experiences of both the nations in tackling this pandemic, and also touched upon the role of the multilateral institutions, both in the India-Africa cooperation context and in the wider context. We heard of the warm memories of many Nigerians, of the Indian teachers who helped education in the early days, and the early establishment of an Indian mission in 1958. We are grateful for the recognition of India's support through the past decades, going through this pandemic, and the perceptive comments which many speakers have given on preparing for future medical crises. We do hope that this webinar will set the tone for future collaborative efforts between us in the face of the multifarious challenges that we jointly face today, which could include, as was mentioned today, about cybersecurity and counterterrorism, which were mentioned by many speakers. So coming to the end of this, on behalf of Team Manohar Parrikar IDSA, it is indeed a proud privilege for me to propose the vote of thanks on this important occasion, which is the first webinar which signifies this initiative to join forces and face the challenges together. At the outset, I would like to express my profound gratitude to General Aliyu Gusau Mohammed, the founder of Gusau Institute, for pioneering this collaborative effort, and also for setting the tone for this very nice discussion today. I'd also like to thank Dr. Maurice from the office of Mr. Boss Mustapha, the Secretary to the Government of the Federation and Chairman of the Presidential Task Force on COVID-19, for his message to the participants. We too share his faith in the vaccine and look forward to the restoration of normalcy at the earliest. I'd like to thank Ambassador Sujan Chinoy, our DG, for guiding us in the preparations for this webinar, for also steering the discussions today throughout, and for illuminating us with his introductory remarks. I'd like to thank Ambassador Abhay Thakur for assisting us in this initiative, not just facilitating, as he mentioned, but for constantly helping us through the last few days to shape this dialogue. We're also grateful to all the panelists for their presentations, and especially to our two chairpersons, Brigadier General Saleh Bala and Admiral Shekhar Sinha, for the conduct of the webinar sessions. Finally, I would like to thank the Africa Center led by Ms. Ruchita Beru for anchoring the discussion from our side through all these days, and our webmaster for making it run through without a hitch. And lastly, all the participants for their patient hearing. Long live the India-Nigeria friendship, and I wish you all good health and prosperity. Thank you so much.
Thank you very much, General Bipin Bakshi, for also ending on this very, very positive and optimistic note. I now request Ambassador Ahmed Magaji, a member of the steering committee of the Gusau Institute, to kindly deliver closing remarks on behalf of the Nigerian delegation.
Thank you.
Thank you very much, Ambassador Chinoy, for a very exciting couple of hours. and for steering the proceedings superbly. We have just articulated our positions and laid the basis of cooperation between our two institutions. And I'm sure none of us waiting or attending will complain at the extra time allotted, because it is time well spent. Apart from our distinguished panelists and those who spoke, I am aware that this webinar attracted a lot of attention, not least from academics. I know practically a particular or two particular faculties in the university that are watching us with keen interest. And they have expressed the view that this is a welcome development for what they would like to be involved. So for me, I think this is just the beginning, and I'm hopeful that this is not the end of the conversation. Professor Isa Abubakar, Professor Yakase, Professor Aliyu Umar, Professor Awal Umar, Dr. Abubakar Suleiman, Dr. Idris Yahya of the faculties of clinical sciences and medicine have been with us, and I'm sure we have not had the end of this, especially from the academics. I think another impressive thing I've noticed is we've managed to gather enough generals and admirals, any military proud, and enough professors to make any university proud. Also, enough diplomats to make sure that those soldiers don't act on their instincts. So this is a very good outing from our point of view. And I think I agree with the Chairman, Ambassador Chinoy, that we need to bring together this synergy of academics, practitioners, thinkers, researchers, so that we can look at various phenomena and figure out ways of addressing them. So thank you very much on behalf of Gusau Institute, to our able chairman, to Ambassador Thakur, who was very instrumental in setting this up, to Mustapha, the Secretary of the Government of the Federation, Dr. Guarzo, Dr. Kumar, Dr. Chitubey, Professor Naki, Ms. Barry, very hard in the background, along with our Marine Maritz, Emeka Izeze, Dr. Baxi, and all those in the technical crew who made this. We are indeed very, very grateful. And I shouldn't forget Major Abubakar, who liaised a lot with the Indian High Commission while this was going on, and the Indian High Commission's defense attaché. So we thank you all for making this possible. And we hope that we will be able to reconvene and discuss this or another issue. So thank you very much, Mr. Chairman. Thank you.
Thank you very much, Ambassador Ahmed Magaji. And might I also remind you that there are great advantages in having this designation Director General. For when the generals are absent, I can still chip in with, masquerading as a general. So there are some advantages there. Now, ladies and gentlemen, it only remains for me to profoundly thank my counterpart, Lieutenant General Aliyu Gusau Mohammed, the founder of the Gusau Institute and today's co-chair, for having cooperated and been part of this seminar today, and also to take this opportunity to wish you all very good health and success also in all your endeavors. Till we meet again, goodbye and good evening from all of us here in India. Thank you. Namaste.
Thank you, sir. Thank you and namaste.
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 Great pleasure. Thank you.
Bye-bye. Thank you.
Namaste.